Thanks very much, folks. And we have the great task of holding up your lunch. It's always the win. So I could talk for an hour on 2 slides, or I can try to do it in 10 minutes. And I committed to Matt to talk about AI in 10 minutes. But it's really important. The conversations that we heard all morning have been really consistent. I would challenge the table. It's great to have consistency, but we probably have a lot of people in here that understand and are in the AI space. So maybe our challenge is actually how do you engage others? Because that's the real piece out there. It's talking among ourselves is nice, and we can learn from each other, but how do you engage others? Thank you, Will. That was a wonderful presentation, and I will comment before we get in there. You made a point about primary care in Canada. I think you said 15% attachment. Nothing to do with me, but I'll put a plug in for Nova Scotia. I think we're down to about 5.5%. Yeah, that's leadership, folks. And a lot of the story on digital is about people and data. That is the story. It's not about tech. Leadership matters. Let's see if I can figure out how to do this. So we talk about the citizen first. We've heard that throughout. We are doing that in Nova Scotia. Our digital transformation puts the citizen first in everything we're doing. And I'm a little bit provocative. I will say in Canadian healthcare, we talk about putting the patient first. It's system-centric. The providers love to be with patients, but the system-centric is where we want to be. In Nova Scotia, we're flipping that switch as we go. Not going to get into this slide really quickly, but it really, in my opinion, AI fails. I think we've heard that. Lack of leadership and data. One of my kids called me a data nerd the other night. I kind of thought I used to be an athlete a long time ago. Maybe 10 years ago I was in high school. We all think that. As an adult, he said, Dad, you're a data nerd. You know, I thought about it. Maybe I am, and I'm kind of proud of that. Because it comes down to data. And in the health sector, that's what matters. So we're going to walk through real quickly how we set the vision, built the foundations, and that accelerates where we can go with AI. I kind of watched these because I could give this presentation inside out, but I think picking up some of the things here, really important slide, really the pieces here, how do we actually put the Nova Scotian first? I challenge everyone to put the Canadian first, but putting the Nova Scotian first is what we're doing. As a citizen, I look at myself, I hear the story in healthcare about interoperability. We can't do this. There's so many barriers. We can't achieve that. That's crap, folks. The finance industry has set the bar near expectation. We've been moving money around globally for decades. We've heard about that, and healthcare is no different. Demand more and expect more, because I do as a citizen. And then when you set the bar high, you're going to achieve the impossible. And that is what we're doing in Nova Scotia. We talk about the Nova Scotian. What do Nova Scotians want? They want great care. They want convenience. We don't talk about that enough. I don't go get checkups. I'm a male. I'm stubborn. And I'm actually busy professionally and personally. Convenience matters. You know what? Trust. Especially in a government world, trust gets lost in a second. You better be able to maintain trust in a digital space. Empowering people is what we're trying to do. Empower people because they're going to do it anyways. You empower people. You help people with navigation. And, you know, show them trusted information because there's great information out there. There's also terrible information. And people are making decisions on a daily basis. So how do we press the easy button for Nova Scotians and help them make informed decisions as best we can? Clinicians, all about the user. Clinicians, how do we improve their experience? We have phenomenal physicians. I was going to call him my physician friend, and I was thinking actually he's my friend who is a physician. And that matters. Like, you know, words matter. But how do we have incredible clinicians that are out there who want to help, that want to provide great care? That's what they want to do. They need the information in front of them to make those real-time decisions and do what they do best. We have administrators in the system who want to make good investments based on risk, based on where do I put my resources, financial and human resources. That's what digital transformation is about in the healthcare system. This could be any slide, any jurisdiction, small, big in Canada. I'd say globally, actually, because we all focus in healthcare on tech. Tech doesn't matter, folks. Tech changes every 6 months. Tech will continue to improve. So we've created excuse the language, a bastardized system in every healthcare organization where we put technologies in place in silos, and then we wonder why people's data can't flow and the information isn't available to the individual, nor is it available to any clinician in any part of the health system. Not the hospital system, the health system. What we've done in Nova Scotia is this, and we did this in 18 months. And I'm not bragging about speed, but I'm saying if we can do it, why isn't everyone else doing it? So we took that old technology, that desperate technology across all of our hospitals in Nova Scotia, across all of our primary care, across some of our pharmacy data, virtual care. And we've put that together and we've built a health record for every Nova Scotian that's comprehensive, and I will say that's unique in Canada. No other jurisdiction, big or small in Canada, has done what we've done in Nova Scotia. And I say that not to brag. I say that we need to challenge ourselves as citizens and demand more, because that's unacceptable. And we've done that by starting with data standards, right? That's how you move financial money around, because finance industry has standards. In health, there are standards, and Nova Scotia shouldn't create their own standards. We should adopt standards that are already out there in the industry, which we have done, because industry who builds systems, they would adhere to that. Nova Scotia doesn't have the market weight to drive it, and frank, Canada doesn't either. The US does and Europe does. So in September 2023, we declared on FHIR version 4, which is an international health standard, FAST. I got to look at it now, HRI, Fast Healthcare Interoperability Resources, which is a standard for health that has all the information in there. We adopted that in Nova Scotia, and we've been driving everything around that since. Subsequently, the US went there 6 months after we did, and Europe's gone there as well. So I feel we're kind of in a safe spot. We've built the heavy lift, we've built the infrastructure and the pipelines. We want to be API centric. I think Hillary mentioned that this morning. Not everything's there, right? Some old technologies. We've done that as best we could, and we've actually built some other pipelines to find those that aren't there, because technology will evolve. And we've mapped data from every system we have to those standards, so we can say that Scott McKenna has a comprehensive health record. So what do we do with it now? What do we do with it? And it's secure. So the opportunity that brings us is to accelerate. How do we actually then do better analytics, better research? How can AI accelerate that on top? And that's what Matt's going to talk about, some of the things we're doing. But in the top layer is our front end with Azure Health Nova Scotia, which is our digital interface, our digital door to the health system, because I want to press the easy button. When I have to Google and take 10 clicks to find out how to get a COVID vaccine in Nova Scotia, that's not easy. Health care, the health system is complicated. And citizens don't know how to navigate. We need to help them, we need to help them navigate. So we've built that. And I am a big believer that I can outsource and buy expertise, but I'm very much against you never outsource strategy. And that's what we've done in Nova Scotia. So we built a platform. Others choose their own platforms. There's no right and wrong. I'm not being judgmental. But that allows Nova Scotia to say how we're going to manage across the health system, how we're going to reach out to people, how we're going to touch people, how we're going to talk to people, how we're going to empower people in Nova Scotia. So I could there's other presentations we can do on deep dives there and the value out of that, but I'm going to move on and focus beyond that. I think I've talked about this slide, data, power, leadership, and all of that we built that foundation allows us to now accelerate and run, and we should be running all the time. So moving to AI, here's what we're done with AI. You know what, at this point, we have more to do, much more to do. We have much more to do on all these fronts, but you don't try to boil the ocean. You make progress. Is today better than yesterday? Absolutely is, and it better be better. Tomorrow better be better than today. So, and artificial intelligence, because we have that data together, it has the power to revolutionize how we deliver care to Nova Scotians. It has the potential to increase access to care, offer tailored treatment options, enhance clinical workflows, and lead to better health outcomes, which is what we want. Before I hand that to Matt, I think we heard some pieces about, sprawl, if I use that word. We focused in Nova Scotia on those 4 themes around the top, because we can't do everything, nor should we do everything. We need to be laser focused. So the areas that we're working through were ones that are under those 4 pillars of what we're trying to achieve. I think the last comment I will make on that would be, you know what, as we talk about health a lot and healthcare, this is economic development. If you have a good health system, and of course you get to a healthy population, that attracts employment, that attracts businesses to the organization, and research itself, which improves people, but it's economic development is directly impacted by what we're doing. And we need to think about that because there is a big circle in that. I'll give to Matt, and Matt, you can talk about some of the cool things that we're actually doing today.
Thanks so much, Scott. And as Scott alluded to, I have an interesting role in what I do. Obviously, I have a lot of involvement in digital health work that we're doing, but I'm also an emergency department physician, so I have a unique perspective on the front lines of what's going on and how a lot of the things we're doing are impacting our clinicians and our patients and the people who are experiencing the change. Thanks so much, Scott, for that discussion, and I think it underpins how important, I mean, data is everything when it comes to AI, right? And the amount of work that's been done, and Scott gets up here and in less than 10 minutes talks what we've done, what the teams have done in the past 18 months, but an extraordinary amount of work, and everything that we talk about with AI is based on the underpinnings of that work. And I love that Scott refers to himself as a data nerd. You absolutely are, by the way, 100% diagnosed. But we've created a lot of data nerds in our organization. And the thing is, when you do it the right way and do it this way, there are so many physicians and physician leaders and clinicians in our organization that are now data nerds. When we talk about FHIR, they get excited about it, which I think is so interesting. But in Nova Scotia, I think what I think is so important is we don't, like, you know, the AI is not just a shiny new tool. We figured, oh, there's this shiny new thing, let's find a place to use it. Really, what I want to talk about is some of the places that we've been able to leverage AI, including the data foundation that Scott's talked about, to solve real friction points in the organization. And when we think about it in Nova Scotia, to me, it always comes down to, you know, what do we think from the patient perspective? How does it impact the clinical perspective, our frontline people serving patients, and then how does it help us administrate and run the system for our system administrators? One of the things I want to talk briefly about is our AI Scribe program. So we've got an AI Scribe program that's been running in primary care with 500 licenses. I think it was alluded to by Will. What we're also doing now with this data is how could we take some of the notes that have been generated from that, and working on a project now where we can leverage AI to develop FHIR data points and help build our FHIR resource with the information from the AI Scribe to offload some of that work from clinicians. So right now, the current state is I make a note, I document it, but then I also have to fill out specific pieces of information or specific fields. How can we automate some of that work? That's something that's in progress. As well, our clinical search tool that we're currently in testing for. So I go into rooms all the time with patients who say, Matt, didn't you read my record? And unfortunately, what I have to tell them is many people have records that are hundreds of pages long. And if I read the entire record before I went into the room, I would never get there. And it's one thing to be able to provide clinicians, when we talk about data and interoperability, to provide a clinician or a user with all of that record. It's another thing to help them make sure that they have the actual information that they need from that record at the point of care. And so what we're building is a search tool that will allow, and it's in testing now, that will allow users to ask natural language questions of a patient record, query the FHIR resource that Scott's referred to, and generate a response directly grounded and linking to where it is in the FHIR record. So I could ask, you know, when did this patient last have this test done? What are medical conditions this patient has? Why was this patient stopped on a medication, et cetera, and actually get that information rather than combing through hundreds of pages of documents. How we're empowering citizens in Nova Scotia. I think hopefully everyone's heard about our Your Health and S app. Hopefully many of you have it downloaded. An incredible resource that's had incredible uptake in the province. But also, how do we help people, though, with a ton of information within there, navigate that information? So we all know how complex the healthcare system is. I get calls, I'm an emerge doc, I get calls almost every day from family and friends who are, I have this thing, or I'm wondering about this thing, or what do I do about this? Do I need to go to emerge for that? Where can I get care for this? Incredibly difficult to navigate, despite the fact that we have incredible teams that have built incredible volumes of content to help our patients navigate the system. but how do you help them find that? So one of the things we've been able to do and launch in Nova Scotia is our Nova Clinical Assistant. Again, not just as an isolated silo tool, but directly embedded in our Your Health NS app, where our content is kind of our digital front door for patients that allows users to ask a natural language question about the healthcare system and immediately find content and information grounded in Nova Scotia approved content so they know it's reliable. And what really excites me maybe the most about that, outside of how many people are using it, is now I get regular contact from clinical teams and clinical areas that say, hey, we know about Nova, we've seen it, how do we make sure that our content is available in it and new content that we're generating is available in it, and how do we test it to make sure our patients are getting reliable information through the tool. And so that's something to me that's very exciting because it directly impacts the patient, and we all know one of the toughest things about the healthcare system right now is how we navigate it. Additionally, some of the work we're doing around with the fire resource, we have a provincial command center to help us navigate from an administrative level flow through the system. We've had our data team has developed the FFAST platform that integrates with the command center that allows us, we can always look, I show up in the emergency department and I can see the tracker, there's, a lot of people waiting to be seen today, or, it looks like we have some admitted patients in the department today, what have you. But to allow us to then forecast, that's fine to know in real time and then we can react to it, but allows us to proactively predict what flow will look like in our system 3 and 7 days down the road. So predicting now to help us make decisions and drive decisions on how we allocate resources. I'm such a firm believer, and I think we all know this, healthcare will always be a limited resource. To me, it is something be cautious saying this, it's impossible for me to envision a day where we have a surplus of healthcare capacity. There's more than we could ever need or use. So much comes down to how do we distribute the resources that we have to the maximum benefit of our patients and citizens. And when we think about the command center and our ability to predict and do that with our FFAST platform, I think that's a big part of that. Additionally, work being done around surgical scheduling, same idea. How do we take data on how surgeries are done and optimize our ROR time? So you can envision environments where you can have a situation where, surgeries one surgery takes longer, one surgery is a bit quicker. But we should be able to predict based on patient factors and system factors and staff factors, how long should a surgery take, how long do we predict it'll take, and more accurately make sure we're using all of the available time that we have in operating rooms and ensuring that they're running as efficiently as possible. The last thing I want to talk about is, actually 2 more before I close. Talking about emergency departments, obviously very near and dear to my heart. One of the challenges we have in our system is around left without being seen, right? So patients who show up in an emergency department looking for care, and for whatever reason, whether it's long waits, something else come up, what have you, they leave before getting the care that they need and still don't know where to go or what to do. So one of the other projects we're working on now, leveraging the data environment that we've discussed, is a left without being seen tool that will allow us to predict patients who are at a higher risk of maybe leaving, but even more importantly, being able to look at information around, so where do they end up next? Is this a patient who, gets a prescription at a primary care clinic and maybe that's something we could have suggested to them or made a difference in? Is this a patient who actually ends up back the next day in worse condition and requires an admission to hospital they may not have otherwise needed? So really being able to look not just at the problem of, a patient who leaves without being seen and the challenge that presents, but then what are the areas that we may be able to go and impact and make a difference, as we know that's an extremely high-risk area in our healthcare system. So I think sort of from a takeaways perspective, those are a couple of use cases we either have in flight now, deployed, or are working on evaluating, testing. But to me, those are all the types of things that we're able to do because we have a robust data environment now. Those are initiatives that are not possible without the incredible work that's been done around getting our data into an integrated, cohesive environment. Truly have a spot where your record is across the healthcare system. And when I talk to clinicians about this and what I'm so excited about with AI, when I talk to clinicians about this type of capability, every room I go to, people start raising their hands. Well, what about this? Why can't we do this? What about there is so much more work to be done, but I really think kind of, as many people have alluded to, we're just at the bleeding edge. We're just at the cutting edge of this. We're just at the beginning. And I think people are really getting excited across the healthcare system. And the thing that I'm so excited about is actually we have the data environment that will support the incredible amount of work that needs to be done to make sure we're providing a reliable, safe, efficient, high-functioning healthcare system for our citizens. So, Scott, was there anything else you wanted to add?
And those Nova Scotians, we have more to do. If you're outside of this province, or challenge yourselves to go back and demand more from your own respective jurisdictions. And, and if we can help each other, that's what we should do, and lift everyone up. We want to reach out. I think we can help others, and we can learn from, we partner, and we learn from them. Reach out to our CEO, Karen Oldfield, reach out to myself, because we look for partners who want to move forward. Not everyone has to move forward at the same pace and scale.